So I'm hoping this is not going to be like a lecture. If you feel that I need to repeat something, please let me know. Otherwise, we can do the presentation and then I can take questions at the end. So I'm not here to help make a diagnosis of dementia, but I'm just going to give you some highlights of what someone who's living with dementia might present with. So I think maybe you might be familiar with some of this. So maybe just to start off, what do we understand by dementia? So maybe let me not ask questions. I won't put anyone on the spot. So this is a definition from the Alzheimer's Association. So they define dementia as it's a medical condition which is associated with loss of memory. Someone might forget their language. So sometimes we forget words. I know what I want to say, or I can identify that is a spoon. I know what it's used for. But for me to tell you that it's a spoon, I can't name it. Sometimes people forget how to do normal activities of daily living, like something which needs a sequence. Somebody might forget how to go from point A to point B. I think we've all been familiar with this. So just because we might forget words once or twice does not mean that we've got dementia. All of us can forget. But if it's now so severe that it's now affecting our daily lives, then that might suggest that somebody has got dementia. But for us to really get a diagnosis of dementia, you need to be seen by a specialist because they need to exclude other conditions. So there are several reasons why someone might develop dementia. So we've seen some people with strokes, or we've come across people with strokes. So some people get dementia because they get some damage that happens to their brain because of a stroke. So when a vessel is blocked or a vessel bursts and we don't have enough nutrition or oxygen going to that part of the brain might, they say it will die. So it loses its function. So some people will develop dementia because it runs in the family. So conditions like Alzheimer's will run in the family. So if you've got that instruction if you got it from both parents, then there's most likely you're also going to develop dementia. So the symptoms that somebody will present with or how somebody will present with depends on what area of the brain has been affected. So unfortunately, there is no cure for dementia, but there are some treatments which can slow down the progression. So it means that you get some treatments and you won't continue to have it going as fast as it would normally do when there is no treatment. So what I also need us to remember is that it's progressive. So it means that you can start off with forgetting words. Then the next thing, you're forgetting how to put on your clothes. You're forgetting how to feed yourself. Or we've seen a couple of reports where they tell you, Sekuru Ombuya so-and-so left the house, we're looking for them. Those pictures that we see on media. So somebody has been going like they've been going to the shops for years, but suddenly they leave the house. They can't remember, how do I get back? Or they are driving and suddenly they don't remember, how do I go from here? So I just put this slide here so that we can talk about some of the warning signs or how somebody can present. So we talked about memory loss. And memory loss is not just words, but a lot of other things. We said somebody can even forget how to do basic activities of daily living. So somebody can forget how to do familiar tasks. So we said somebody can forget how to feed themselves even. Then problems with language. So like I mentioned before, so somebody knows what that's used for, but they can't name it. Sometimes somebody is disoriented to time and to place. So you ask them, they get up and then they're telling you, no, it's now evening. Or you ask them, where are we? And they're telling you, no, I'm at my rural home where I grew up. So some people, poor or decreased judgment. We've heard of cases where people lose their assets, right? So somebody signs off and they sell their house for 10,000, a house which is worth 100,000, 200,000. So changes in mood and behavior. So I've come across two groups of clients. So when some people are starting to forget, they don't you tend to see two groups. So I've seen people who tend to become a bit aggressive. So they know that they are forgetting, and when you ask them something, so instead of telling you I've forgotten, they get angry. So maybe they are angry with themselves because they can't remember, or they are angry because, why are you asking me? Then there are some, they know that they've forgotten and they can actually make a joke about it. So I asked one of my clients, can you please count back, like from 20, come back to 1. And sometimes I'll tell them, if you don't remember, think of it as you've got a $20 bill. You buy something for $1, how much do you have? Because I want them to count back until they get to 1. So this particular one, they were able to count from 10 coming down. So I said, no, Sekuru, please start from 20, come down. Then they're like, iyo maths andisatindayita. Iyo syllabus andisatayita. So you might be familiar with some family members that you've come across. Somebody will joke about their forgetfulness, but somebody will become quite aggressive and withdrawn. So the other challenge, when we talked about people who are getting lost, somebody will forget where they are, how to get from point A to point B. And because people are becoming forgetful, we're social human beings. If you realize that you're forgetting maybe topics that people will talk about usually, or you want to come to church and maybe you don't have your hymn book and you're forgetting the words to the songs, sometimes you'll decide, well, I might as well just stay home and not meet up with people. So these are some of the presentations that people might have when they are living with dementia. So, people living with dementia, sometimes we notice that someone will deteriorate quite quickly. They went from normal functioning a few months ago, and suddenly now, if you see them a few months later, they can't really remember things at all. So why is there different speed? So we know that with some people, we said if it's caused by a stroke, which we call vascular dementia, it happens quite quickly. You've gone from one day where you're able to do a lot of things, then the next day they can't. But it sort of like happens in steps. So they have the first stroke, they don't remember how to do some things because of the part of the brain that's been affected. If they have a second, then they maintain that function. They get another stroke. It's like steps. Then they come down to another level. They might maintain it until they get the next stroke. But then with the other types of dementia, like with the Alzheimer's, they'll sort of like progressively forget things. It's more of a gradual process. So why are some people deteriorating faster? Let's exclude the vascular dementias. So I wanted to provide a scenario for you. So I'm sure all of us have held a baby at some point, whether it's ours or not. When you're holding a baby, what do you do? What do you do with the baby? Yeah, you talk to them, you play with them, you might get a toy, colorful, right? When we have children older than the babies, what do we do? You've got a toddler in the car. What do you make sure you have? You're driving from, now there's traffic and you know it will take you 2 hours. What do you normally do with the toddler? You'll have, entertainment, right? We want to keep them engaged. So same as now we're adults. If I'm going to take a long bus trip, what might I carry with me? Yeah. So my question to us is, when we've got our elderly parents, we take care of them, we do a good job. But why is it that we're only concerned about, I've provided their medication, I've provided their food, but we never think about, so Mama was a teacher in the past, and maybe she enjoyed reading. Why is it that we don't buy books for them, or maybe make them join a library if it's still possible, or even get the Kindle if they can, if they've got devices? Why do we not do that? Do we not need mental stimulation as we get older? You've retired, so bye, we don't care about you anymore. So we've seen some people when they retire. I gave this scenario the last time that I talked about this, to say we've got two groups of people. Somebody will have a retirement plan. So when they retire, they're getting into projects, they're going to do some chickens, they're going to, do a lot, travel, whatever. Then there's someone who's going to say, I worked too hard. I've retired. Now is my time to catch up with, I gave the scenario of Z-World or whichever TV programs somebody likes. So if you've come across those people 6 months post-retirement and you meet them, what might you notice? What is the difference between this one who's got activities that they are doing and this one who's just seated? What might you notice? If you engage in a conversation, do you feel like they are both still at the same level? Who seems to be doing more poorly? Yeah, so mental stimulation. Even when we get older, we still need mental stimulation. So we need to continue learning new things because our brains need to continue forming new pathways. So we shouldn't take this away from our elderly parents. We're not taking care of them. Okay. And then there's something called social psychology. So some people will do worse off. Why? So there's 3 things. Disempowerment. So unfortunately, we don't have a lot of men in the room. So a lot of the times, let's say we've got Gogo, let me say we've got Gogo Chimbetete. If she becomes unwell, and then you decide, let her come over, and then she stays. And then all of a sudden, or maybe that's the scenario where Mama worked so hard for us. So when she's here, I want her to enjoy the fruits of her labor. So Gogo Chimbetete is not allowed to touch anything. So she gets up in the morning, food is brought to her, she just sits. When the water has been run for her, she goes to bath. And it's a good thing. We should take care of our elderly parents. But we're robbing them of mental stimulation. And if someone is still able to do it, let them do it. So if, for instance, my Chimbetete was to say to Gogo Chimbetete, Gogo, memfana kumboti mombopota muchiti mo waridza mbeda wenyu mukapedza kuchika muendesa plate. I can imagine what's going to happen in that house. I think some brothers-in-law are going to be called and some tetes, like mwana wenyana kurairo. But no, actually, that's what we should be encouraging, right? Let's not disempower someone. As long as they can still do it, let them do it. And then the other one, infantilization. So this is whereby we're treating an older person like a child. You know, like how we tell our children, you do this, you do that. But just because somebody is starting to forget doesn't mean that they are forgetting everything and they can't do everything. As long as they can still do it, they should continue because we want them to continue learning. We want those neuronal pathways to continue to be new ones being formed, the old ones to be kept active. So that's those people who still do things, you realize that they don't deteriorate as fast as the ones who have everything done for them. So other people might suddenly withdraw from doing activities at home when they've got dementia because we are asking them to do more than they can handle. So if you're now telling me that maybe I should help my grandchild out with homework, maybe I was a teacher and help out the grandchild, and I don't remember those things, what am I going to do? I'm going to become aggressive. Or I'll just say, I don't know, and then I'll keep to myself. So we should appreciate somebody's level. So we said, as long as they can still do it, let them do it. But we also don't want to give them too much such that they lose their confidence and they decide to withdraw. So sensory stimulation, we use it for our children. When we buy babies' toys, we want those with bright colors, and we want to continue those things. If somebody likes listening to the radio or watching television, provide that for them. That's their sense of stimulation. Somebody might think, I enjoy going to the garden, pulling out the weeds. Let them. If they are still able to, let's continue. We need people to continue to have this sensory stimulation. So, I'll say this again. If they can still do it, let them continue. And we want to encourage them to try out new things. And because we're social human beings, people who've got a good social environment tend to do better. in terms of the rate of deterioration of dementia. So how do we include our elderly parents in family activities? So sometimes we'll say, gogo or sekuru is starting to forget, so we can't go with them to church because vachanoimba discord to zonyara. Let them go. You know, like the more that we try to hide people who are living with dementia, the more this becomes a taboo. But a lot of us are experiencing it. Let us embrace what it is. If they can still manage to go to church, let them meet up with their friends. People who are sociable or who continue to have their social network tend to do better. So if you've got your child, for instance, they go for, there's sports days, there's prize-giving days, weddings, make sure Gogo and Sekuru get photos, let them be involved in those photos. Then, because we want them to be involved, what can you do? What kind of activity can I get to stimulate their senses, their memory? You know, when we were growing up, we used to have those photo albums, right? Now nobody keeps them, or a few people still have them. It would be good to just say, get the photos printed out, and then Gogo and Sekuru will arrange them the way that they like. When they decide to go back to their home, they can show off to their friends. This is my mzukuru. Because I remember when I used to visit people, you know, like that was one of the first things that would be taken out. And they're telling you, oh, this happened and at this event. It's good if you've got the photos on the phone, it's good, but just that new activity, gluing things together, sticking them onto a page or putting them together, that's a new activity for someone. So I'm going to share a contact for an occupational therapist. So there are people who are actually trained, who can actually assess the level of the person that we're caring for to see how much they're still able to do. And then they give them activities that they can do as an individual or that you can do as a family so that we can continue this mental stimulation going. So I'll share it at the end of the slide, a couple of resources. So we're coming to the next issue. Maybe I can stop here if you've got questions, or I continue, then we take questions at the end. Questions at the end. All right. So how do I communicate with the person that I'm caring for who's living with dementia? So because we know that they are forgetting, we don't want to create conflict. So how do we encourage communication? Focus on opinions rather than facts. So I might not remember that Zimbabwe gained its independence in 1980. I don't remember that actual date, but maybe I can, you can ask me like, so how did you feel around that time? What was happening? Or, yeah, what do you think about? You don't want to ask someone facts because we know that they're starting to forget. If they can remember them, it's fine. But if you want to strike a conversation, we want things to continue flowing, we want to engage them in the family dynamics, let's ask about opinions rather than facts. Then ask about the emotional meaning of issues. So emotions are never wrong, right? I don't like this, or I enjoy doing this. Somebody's emotions cannot be wrong. They can differ from ours, but they can never be wrong. So you can focus on that. So I'm going to give you a couple of scenarios. So, you know, like sometimes this is our mom, this is our grandma, and we've known her for a long time. So we go and visit her, and we're suddenly getting frustrated. Come on, you know who I am. We're saying that they are forgetting. They might not know who you are. So how do I, when I come to them, what am I going to say? Introduce yourself. Hi, I'm so-and-so. It's nice to meet you. You're already going to strike a conversation. Things are going to start flowing from there. Sometimes we meet someone and then we say, we've been told Gogo is starting to forget. Then you go and visit her. Then you're like, do you know who I am? Like, that's what we do. And sometimes, you know, like, because we said somebody's emotions are not impaired because they are starting to forget or they are living with dementia, you've already closed the door to further communication, right? So how can I go about this? So I can introduce myself. So sometimes we've got a family, or like the way that we address someone, which is more common. So for instance, you are now known as Gogo so-and-so. We can encourage the family, let's maintain that name. So every time you're talking to Gogo, it's Gogo Vatawanda. So everybody's going to address her by that. And then you're going to introduce yourself. I am so-and-so, I'm your grandson. And we said they are forgetting. You are not going to say, do you remember what happened on my wedding day? They might not remember. So what are you going to say? So it can be, I remember. Not you should remember. Like, this is, like, I'm now telling them, oh, I remember when we went to so-and-so's wedding. We had so much fun. Then the next thing they're going to be asking you, so what did we do? Then maybe you'll say something, then they'll actually join in the conversation, and maybe you've actually reactivated a neuronal pathway which, had been inactivated for a long time. So someone's emotions are not impaired because they are living with dementia. Let's find ways of engaging in conversations that are not going to make them close up to conversations. Because we said, as long as we maintain that social circle, the chance of deteriorating decreases. So I'm going to talk about, there's a technique, so I'm not going to talk about medication. There's a technique which is called cognitive stimulation therapy. So maybe let me give you a definition, and maybe you can associate the scenarios that I gave you of somebody who's got a retirement plan, and then the other person who's enjoying Z-World. So cognitive stimulation therapy is a method of managing dementia, which is effective for people who've got mild to moderate dementia. And it's associated with improvements in language. So imagine as a caregiver how much your life would improve if suddenly the person that you're caring for is able to tell you, I'm hungry, instead of just being grumpy. If somebody's able to tell you, I'm in pain, and let me just get a painkiller for them. Do you, like if you've looked after children, that good time when they start talking. So we say we've got terrible twos. Why is the twos terrible? Because a lot of the times the kids can't express themselves yet. But once they know how to talk, suddenly, we start suddenly enjoying looking after them because now we can communicate. So if this therapy improves the language. So if we are now able to communicate better with the people that we're caring for, it does make both our lives easier. So cognitive stimulation therapy, it involves a wide range of activities. And these activities, they stimulate thinking, they stimulate memory. So, and it's simple activities that we do on a daily basis. So for someone, it can be just gardening. For someone, baking. For someone, it's playing games. For someone, it's listening to music. For someone, it's just maybe like crossword puzzles. So I'm going to put up a few images, and we're going to practice a little bit this cognitive stimulation therapy. So it's normally done, 14 sessions, usually over 7 weeks, 1 hour each. But even if we don't have something structured, I just want us to appreciate some of the things that we can do in our day-to-day activities that can help the people that we're caring for while living with dementia. So I've put up this image. We've got, I don't know if you can recognize anyone or any people. Can anyone recognize anyone? Any takers? Westlife? Okay. Okay, so the group, yes, there's Westlife. Any other musician that you can identify? Sorry? Jah Praiser. And? Okay. So let's say we're practicing cognitive stimulation therapy, right? An example. For someone, when you saw Jah Praiser, like what did you think of when you saw him? What came to your mind? Okay, so yeah. So for someone, you thought of a song. Somebody will think of, at my granddaughter's wedding, we danced to this. Or, your Sekuru used to love this song by this person, right? So we said, as long as we can maintain some conversation, we are able to continue activating some, like that mental stimulation continues. So for some, it means I'm going to show them a photograph. So for John Chibadur, does anyone know any song? Okay. Somebody mentioned Mudiwa Janet. Is it the one? Never. Okay, so maybe I chose the wrong musicians. So when you're doing this cognitive stimulation therapy, what's important is you need to know someone's background. So let's say somebody used to listen, like you know the kind of music that they used to like. So you might play the music, you might show them the photo on the album, things like that. Know your person, the one that you want to try and get engaged. Then this one. These are childhood games. Any of them familiar? Okay. What kind of memories came when you looked at these? Like you saw any of these? Yeah. Okay, so somebody might remember maybe when they did this and then they tore up their clothes and they got into trouble. So yeah, so you can imagine like a single photograph will mean different things to different people, but that's the point. Like here it's not about, we're not asking for facts, it's how do I feel, or what does this, like how do you feel about this, or what does this sort of like, okay, if I say, do you remember this, it's wrong because we said some of the times they might not remember. We want to focus more on emotions or their opinions, or it might even be, in the olden days, people used to play such games, and now the children are playing these sort of games. What do you think about it? Like, let's talk about how children are playing now and how you used to play, if they can relate to that. Then there is one which is going to be quite noisy. Okay, so we want to stimulate senses. So we've talked about you can show photographs. Sometimes you can even play some sounds. Did anyone get that? Baby crying. So for someone, they had the baby cry, and then they can associate the sound with the picture. But some of us, we heard the baby cry, and what did we think about? Some of us were like, I'm just glad that first month of life we're past that stage. People think of different things. They relate differently to different things. So maybe let me just let me not play all of them for the sake of time. Maybe one more. Sorry, this wasn't loud enough. Let me look for another one. Did we hear that? Should I play it again? What do you associate the sound of a bell with? Break time. I went to a Catholic school, so yeah. Sorry, let me just do this, get off the slide, because it's going to play all of them again. Okay. Then the last image. When we look at these, how can I get somebody engaged in a conversation about these photographs? What sort of conversations can we have? Okay, so somebody might tell you, so remember we said you need to know the person. So some things have to be like culturally relevant. So maybe if Gogo has been kumusha all her life, and then you show her like a picture of hot dogs, it might not mean anything to her. But if I then show her maybe this photo of Maguru, then I ask her, like I want to try and engage in a conversation. So Gogo, like, how do I prepare? Or Gogo, explain to your msukuru here, like, how to prepare this. Because we said sometimes when somebody is living with dementia, they forget sequences. So if we can get them to talk about sequences of doing things, or let's say I give you $20 and we want to bake a cake. Like, maybe, can we draw up a budget for how we're going to use our money? Or tell me the ingredients that are needed to buy a cake. Simple things like that. So what kind of advice can we give to the people that we're caring for and to caregivers? So it's important to have medical assessments. So we know that some medical conditions can predispose somebody getting dementia. So if we've got poorly controlled hypertension, poorly controlled diabetes, you might get a stroke and you might end up having dementia because of the vascular dementia. So we need to make sure that those things are put in place. We also need to do like other lifestyle modifications. If we can stop taking alcohol completely, especially as we grow older, alcohol has got a lot of effects on the brain, and some of them are more difficult to sort of like control for as we get older. And then if we smoking, to stop smoking completely. And then there are other things which can improve quality of life. So, visual assessments. Simple things like just take someone for just reading glasses, assessment for reading glasses. If they're living with hypertension or diabetes, then they need to see the ophthalmologist, have the fundoscopies done. Hearing assessments. You know, sometimes something as simple as wax, which is blocking the ears, can actually reduce somebody's hearing. So how much would you improve your communication with the person who's living with dementia if we just got rid of the wax? Dental visits. So some people will stop eating some types of food because they are not able to chew. And if we then start having nutritional deficiencies, then the picture is going to get worse. So we've had some people who've got vitamin B12 deficiency, for instance, and they can present with some cognitive difficulties, and yet it's just a nutritional issue. So physical activity. What is good for the heart is good for the brain. So even if it means that physical activity means different things for different people, someone will just want to walk from point A, they wake up, they move around the compound. That's their exercise. For someone, they are going to continue wanting to walk 5 kilometers. Let them. Let's not, it's different, like somebody's getting lost. Then it means that we're going to need to do something. They want to walk, let's accompany them. Physical activity is still good for them. So, routines, we need to have routines in the house. So there are those scenarios where we take our elderly parents from their house and then we want to stay with them. We want to look after them. Maybe there's no one to look after them there. It's good, let's look after them. But sometimes people tend to do badly when you take them away from their usual environment. So they are so used, like repetition. So now some things are now routine for them. So now you bring them, now they're supposed to learn where is the bathroom, where is the kitchen, then we start having difficulties. Oh, somebody is now having incontinence, like they have to wet themselves before they get to the bathroom because they can't navigate our huge houses, if we have huge houses. And then also in terms of repetition, so what I normally like to tell people that I come across is, Gogo sekuru, yes, you're starting to forget, but there are some things that can help you. So if have your space where we know that you keep your money, or you're going to sleep, you keep your phone. Because what usually happens is we usually have someone who's looking after them, right? Like let's say if they're not staying, even if they're staying with us or they're staying elsewhere. And then you give them money, then they can't find money. If I can't find my money and I'm living with people in this house, where did the money go? Yeah, there've been so many cases of like somebody comes to visit, then they start telling on you, or we want to have those routines where normally we know that they eat at this time, because you'll end up going to hear stories of their sekuru comes to visit Anjadzi. we know that they are very powerful, right? Very powerful people. And suddenly they are telling on you, they are not giving me food. So we need to, those routines are important. Then we said, don't disempower. As long as they can do it, let's encourage. I know sometimes it takes a long time for them to finish eating, but as long as they can still remember how to take the spoon, dip it in, let them continue. Because once you take that away from them, like they are being too slow, so we get a nurse aid feeds them, they are going to lose that ability. Then social capital, we said we want to maintain those relationships. And then we said, dementia doesn't take away somebody's emotions. Yes, sometimes they might be impaired, but it doesn't take away somebody's emotions. So we try and maintain that respect that we have for each other. But I think one of the most important things that we usually forget as caregivers is we need to be kind to ourselves. Looking after somebody who's starting to forget is a lot of work. Sometimes we can't even recognize this person that we've known all our lives because suddenly they don't remember who we are. So be kind to yourself. Ask for help. Take a break if you have to, and take care of yourself. Your mental health is also important. I would have done an injustice if I don't talk about this. End-of-life discussions. I know this is very taboo in our culture. We don't usually want to talk about end-of-life issues. But if somebody is diagnosed of dementia and is still early stages, at least have a family conference. And I like family conferences like when we have them within the medical, like with the medical caregiver and the family. Why? Because I feel like there are some things that we can talk about that you as the child might not be comfortable to bring up. So what kind of issues should we talk about when we have these family conferences? Caregiving model. So who is going to look after Sekuru or Mbuya or whoever has been diagnosed of dementia? So at whose house are they going to be looked after? We said this is progressive. Should things start really getting bad, are they open to being taken to a retirement home? And if we bring it up as medical personnel, I feel like it's easier to accept. Because I can imagine if you are telling your husband that the mother-in-law should go to a retirement home. You know, like I've got young kids. My kids are like 3 and 1 is turning 6, and they are boys. I actually told my siblings, you know what? Usually, Hamadzanamai, if the mom is the one who's starting to live, who's living with dementia, they are the ones who really give children a hard time. You are throwing away your parent by taking them to a retirement home. I actually told them, you know what? Allow these boys to take me to a retirement home. Because, you know, culturally, for me to go and live with my son, what does it mean? Let's say they are not able to get a nurse aid for me. Can my murora bath me? What will that mean culturally? Yeah, if that were to happen, what's going to happen? Yeah. So these kinds of things are complicated for us as Africans. So that's why I feel like some of these conversations are easier to have if we have a family conference and the medical caregiver brings up these issues. Then medical treatment. How far do you want us to go? Some people will tell you, you know what, if I'm towards the end of life, allow me to rest at my house. Why do you have to be pricking me and giving me drugs that are not going to really change much? But you know, like sometimes it's difficult to say when somebody is unwell, and then usually if somebody is older and they're unwell, the whole family comes to the clinic or to the hospital. Then everybody has to be seen doing something. Right? Because now, we've got the register. Who wasn't looking after our mother when they were unwell? Everybody has to come there. And usually people will just want to drive to just say, let's go, let's do as much as we can. But if we have this discussion while this person is still able to make the decision, it makes it easier for us, right? There's ways of going about it, like power of attorney and things like that. Asset management. sometimes you as the child, you as the musukuru, you can't then say, Saka Baba, say, like, what are we going to do about your properties? So if we have these conversations, the family conference with the medical personnel, and then we say, look, we've got this condition, we've diagnosed dementia, but we need to talk about what are we going to do as this progresses, because we are anticipating that it's going to progress. We might not know how fast it's going to progress, but we need to know, what do you want people to do with your assets? Because we don't want those situations whereby somebody signs off their car, they sell it for $1,000, they sign off the house, and it goes. Okay, yeah. So I had said I was going to share some resources where you can get some assistance. So, dementia has to be diagnosed. I didn't put names of all neurologists that I know, physicians. I put one, I put a psychiatrist number, because I'd spoken to them and they said they are open to home visits, or you can book to see them at the rooms. Why I also put a psychiatrist is that some people with dementia might present with hallucinations. You know, we've had those scenarios where somebody will tell you, you're living right in the heart of Harare, and Gogo is telling you, ndichambo famba ndimbonona, ndimbono yambuka Ruizi, ndimbonona ningi. Or they are talking to someone and you're wondering, like, what's happening? So these groups of specialists are the ones who can assist us in the management of dementia. So we also have an organization which is called ZADA. So ZADA has actually, it offers training for carers. So it doesn't mean that we get an S8. If you do have an S8 and we want them to learn a bit more, we can send them. But even an informal carers, like what most of us become anyway, suddenly you're looking after your mom or someone, you can get some training. It costs a bit of money, $40, because they also have to pay for the training material and for the people who come to train. So I've put their number as well. Then I talked about the occupational therapist who can assist with assessments and giving those activities. So there's Tanaka. I also had a chat with her today. Girl Power. Dr. Mashandu is also a female. Tanaka, the therapist, is she's got rooms where we used to have a Highlands halfway house, so that's where she's located. She's also open to having home visits. So these are the resources that you might find useful. And like what Dr. Chimbetete mentioned, I'm going away to try to go for training. I like to think of myself as a future geriatrician. This is a doctor who looks after older people. So what I'm planning on doing in the future is I want to open sort of like a social media platform. It's not for medical diagnosis, but where I'll be sharing tips on how informal carers can look after their elderly. So this is what it's going to look like. Once I've got the pages running, I'm going to share the links with my boss, Dr. Chimbetete. So this is the end of the discussion.